Welcome to your at-home diagnostic exam, powered by KIT. Your healthcare provider is providing this simple at-home kit to obtain necessary health data. This whole process will take approximately 25 minutes. Please do not skip any steps or try and complete the kit on your own, as this will invalidate the exam. After each video chapter has played, you will have the option of replaying the chapter before proceeding to the next step. Please make sure you are going through the kit with ample-sized table space and chair. Please take the phone stand from the back of the stop sheet and place it in front of you. Push your finger through the notch in the phone stand and set the red flap tip to touch just below the red striped rung. We recommend you remove your phone case for best fit. Place your phone horizontally as shown. We will now go through a step-by-step process to collect a micro blood draw. Don't worry, we have cut this section into short segments so you can follow along easily. However, you must complete each step before moving forward to ensure a valid specimen. Take out the blue finger prick box and open it. Inside of the foam tray you will find a finger prick accessories envelope with gauze pads, alcohol pads, Band-Aids, and a trash bag. A hand warmer, 1 yellow lancet, 2 blue lancets, a finger compressor to help express blood into the tube, and 1 blood collection tube. Take the finger prick accessories envelope and remove the gauze pads, alcohol pads, Band-Aids, and trash bag. The trash bag is provided for wrappers. Take both the gauze pad and Band-Aid out of their wrappers, ready for later use. This is an important step before you prick your finger. Locate the finger compressor in the finger prick tray. Please remove this and set it to the side for later. Next, take out the lancets and set those aside for later use as well. Look within the finger prick box tray. Remove the blood collection tube. Then, place the plastic film back onto the right side of the finger prick box. Twist and pull to remove the cap from the blood collection tube. Then take the tube and place it down firmly into the open hole located on top of the clear plastic film. We will now do a test of the lancet. The yellow lancet is provided to show you how the device works. Take the yellow test lancet you set aside previously. Leave the blue ones for later. To remove the safety pin from the yellow test lancet, twist it 90 degrees, then pull the pin out. Move the lancet over to the white dot area found on the foam, then hold the device between the index finger, middle finger, and thumb, and press down firmly against the gray foam. This will activate the test lancet. This was just a test. Please note, each lancet can only be used once. Take one of the blue lancets. Twist and remove the safety pin. Set the blue lancet aside for later use. The other blue lancets are extra and included there in case you need another prick to complete the draw, though this is often unnecessary. Warming your hands makes the finger prick easier. Pull out the transparent hand warmer from the blue box tray. Inside, you will see a metal coin. Let the coin fall to the corner of the pouch. Now press on the coin between your index fingers and thumb. You may hear snapping sounds as you press it. You will notice the hand warmer turn white and get warm to the touch. Apply the hand warmer to your middle finger for 1 minute. Stop and carefully reapply if you feel it's too warm. If you are unable to activate the hand warmer, you can try warming your hand with warm water from a water faucet for 30 seconds. Press the start timer button to continue. The finger compressor is a device that makes the blood draw much easier. Please locate the finger compressor you set aside previously. Remove the plastic wrapping and the illustrated finger guide. Take the alcohol pad and clean around your middle fingertip. With your right hand, pick up the finger compressor. Open the loop of the compressor as shown. Take your left hand and place your left middle finger through the loop. The placement of your finger is key, so make sure you pinch the white foam on the compressor between your middle finger and thumb, and hold. Only the tip of your finger should be visible. Leave the compressor on in this manner while you prick your finger in the next step. It's now time to take the micro blood sample. Take the blue lancet you set aside previously. Make sure you have removed the safety pin. Press the blue lancet down firmly into the tip of your middle finger as shown. Try not to recoil, as a firm finger prick will create good blood flow. You will hear a small click sound. See, not so bad. Please dispose of the used lancet. Now point your middle finger down into the blood collection tube. Slowly begin pulling and releasing the compressor stem. Make sure to loosen the compressor between each drop to allow for adequate blood flow to your fingertip. You should feel some pressure on your fingertip. Repeat this milking motion until the tube has been filled to the top fill line. Keep a steady hand over the funnel so blood drips into the collection tube and not around the sides. It helps to have the blood droplets slightly touch the inside part of the funnel to help them drop in, but do not scrape your finger against the funnel. Keep collecting droplets until you reach the top black fill line, as you see here. You will need approximately 6 to 8 drops of blood, on average, to fill up to the top line. You're almost there. If you're having trouble filling to the line, you may want to try again with the extra blue lancet provided on a different finger, though in most cases this is not necessary. Again, please fill up to the top line or the test will be invalid. Press Next when you have filled to the top line. If you have used 2 lancets and still need help, press the Help button on the lower left corner of your screen and a live customer care coordinator will come to assist you. Take the gauze pad and dab the pricked finger. Take the Band-Aid and wrap your finger. Great work! Now we will move on to the next step. The hardest part is over. After you fill to the top line of the blood collection tube, please snap on the cap tightly. You should hear a small click sound. Then remove the tube from the plastic hole and gently invert it 10 times as shown. This part is extremely important to ensure that your exam is valid. Do not shake the tube or mix it too aggressively. Try to use the technique shown. If you skip this step, your blood sample may not be stable over the mail. Please make sure you invert the tube 10 full times as shown. You may place the tube back into the plastic film hole after this step. Press Next to continue. To have a valid specimen collection date, we need to take a quick picture of the blood specimen. Please hold up the tube to your phone's camera and click on the Take Photo button. Repeat until you get a clear picture. Take out the green sample prep box and open it. Please remove the tamper-proof biospecimen bag and the return stickers envelope, putting them to the side for later use. You will also notice that we have included a tasty treat. You earned it. Place the blood sample tube into the tamper-proof bio bag. Remove the yellow adhesive strip of tape from the seal located at the top of the tamper-proof bag and seal the bag closed. Put the blood specimen tube and bag back in the blue finger prick box. Now we are ready to mail the kit back to your provider. Please go over this checklist as a final step to make sure you have all of the following items within the box before sealing it closed. Place all boxes back in the shipping box as shown. Close the box and seal the lip of the box using the sticky seal. Now we are ready to mail the kit back to your provider. The adhesive shipping label has already been placed on the side of your box for your convenience. The box must be put in the mail within 24 hours or it is invalid. Please drop the box off at your local UPS store. Thanks again for your tremendous cooperation and for using KIT. Your provider will contact you soon after we receive your package. Have a great day.